Hi YouTube. So we're back today with a video on agoraphobia. Yes, it took longer definitely to get this out. I would just say I have a little bit going on. Anyway, so basically what's going on is I found out like at a drop of a hat that I'll be registered for the NCE exam, which is starting in October. So basically I have a month to start preparing to take my NCE exam for my licensure. So yeah, that has been keeping me dedicated, focused, time management, all of those. Because yeah, the test ended up being 335. And that's just because if I pass the NCE exam, then I can get my NCC credential, which is a credential national certified counselor. So I'll be a national, and then I can apply for my state licensure. So basically, that has been just keeping me busy. I've already started ducking and dodging some people and things. So yes, anyway, I guess YouTube has been part of it. So I'm sorry, guys. Anyway, so let's get into this video. Agoraphobia. It's actually considered an anxiety disorder. Oh, wait, let's go back. So welcome to Counseling Minus the Bull. I'm Candace. Please like, share, subscribe, and comment below, and keep it general, confidential. Please, let's not be disrespectful. But anyway, and we're going to do the video today about agoraphobia, which is an anxiety disorder. So according to the DSM, it is marked fear or an anxiety about two of the following 5 situations. The first one is using public transportation. The second one is being in open spaces. The third one is being in enclosed places. The fourth one is standing in line or being in a crowd. And the fifth one is being outside of the home alone. So when we did that video and I mentioned, I believe that it was referring to having a fear of coming outside, it seems to be very true, but we also have 4 different other situations that can be presented. And basically it's saying you have to have 2 of these fears that was previously read. And going on, the individual fears or avoids these situations because of thoughts that escape might be difficult, or help may not be available in the event of developing panic-like symptoms or other incapacitating or embarrassing symptoms. Example, fear of falling in the elderly, or fear of incontinence, meaning not having control of your bowel or bladder. Going on, the agoraphobic situation almost always provoke fear and anxiety. And then the agoraphobic situation are actively avoided, require the presence of a companion, or endured with intense fear or anxiety. Wow, yeah, so it has more criteria. So it's actually from A to I, and we've covered A through D. So E is the fear or anxiety is out of proportion to the actual danger possessed by the agoraphobic situations and to cultural context. I cannot think of that. Okay. F, the fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. G, the fear, anxiety, or avoidance causes clinically significant distress or impairment in school, social, occupational, or other important areas of functioning. H, if another medical condition is present, the fear, anxiety, or avoidance is clearly excessive. And then examples may be IBS or Parkinson's disease as far as medical conditions. And then I, The fear, anxiety, or avoidance is not better explained by symptoms of another mental disorder. For example, the symptoms are not confined to specific phobia. Situational type. It does not involve only social situations, as in social anxiety disorder, which, as I was reading this, I'm like, this has a lot of the criteria for social anxiety disorder, and are not related excessively to obsessions, like OCD. Perceived defects or flaws in physical appearance. Now, that's something we can do. We can do body dysmorphic disorder. So, yeah, we can do that. We have talked about that. Reminders of traumatic events, as in PTSD, or fear of separation and separation anxiety disorder. So you must rule out all of those disorders before giving the diagnosis for this one. It also goes on to say agoraphobia is diagnosed irrespective of the presence of panic disorder. If an individual's presentation meets criteria for panic disorder and agoraphobia, both diagnoses should be assigned. So basically it's saying you can have panic disorder plus agoraphobia disorder. All right. So since it's an anxiety disorder, I'll just go over some of the anxiety. Okay. Let's go here. So for this one, I'm actually thinking of course, CBT can be effective for most of mental health disorders, where you are examining your cognitive thoughts, you're identifying your irrational beliefs, and then you're also challenging yourself in to create and to model healthier behaviors. I'm sorry, this camera thing, I'm just moving all crazy. So I will say CBT can be used for this as well. With panic disorder, we're also looking at relaxation techniques such as counting to 10. I said panic disorder, right? Didn't I just said it. Well, anyway, you can use things like relaxation techniques to help with anxiety. Deep breathing, counting to 10. Sorry, I have this lipstick. It's like a chunk of lipstick. Okay. Anyway, counting to 10. Some people use the paper bag to kind of breathe in and out in. As well as we can get into like some behavioral things such as systematic desensitization. So it's kind of like exposing you, and this can be imaginary or this can be actually live, to situations that you have this fear and anxiety about. So basically what you'll be doing is, let's say if I had so this is more like phobia work, okay, that I'm talking about now. Let's say if I had a phobia for pink, the color pink. I'll just look around my room. Basically being exposed to pink, the color pink. So it can be imaginary, where a counselor can advise a client to, basically do like imagery, imagine being exposed to pink, being in an all pink room. And then as well as actually being in an all pink room live are ways. There are ways to actually get through this process, always beginning with relaxation. So there are different stages to the systematic desensitization. And you always want to keep that in mind. You always want to go by theory, and because it's proven research. Yes. So that's another way to kind of go through this as well. So I'm actually thinking of people who have a fear of leaving their home, or they can't leave without a companion. So some of the things would be exposing the person to come outside and challenging them to see that basically their fear is not in proportion to what they're thinking. That's not to say that with everything going on with the pandemic or crimes or things of that nature, it's not a risk, because it definitely is. But the fear is not in proportion to the actual risk. And that's similar to the social anxiety disorder. That's one of the criteria I was saying that reminds me of the social anxiety disorder. So I'm going to stop here. It seems like I've kind of been rambling and it has not been organized, so I'm sorry. But basically, we looked at this disorder and found out that there are other criteria. So you must have 2 out of the 4. And then there are also A through I criteria that you must fit as well. Ruling out other similar disorders, ruling out medical conditions, ruling out substance abuse, drugs. You must have an impairment. You must have this unproportionate fear or anxiety, risk. What else did we say? I would be at that. Yeah, here we go. Avoidance to the situation, of course. Yes. And it must last for 6 months or more. So I'm going to wrap up here, guys. Feel free to leave questions below if you want me to go more in depth. Anything about the disorder, if you want to talk about systematic decentralization more in depth, because like I said, there's different stages to it. So if you want to know more about that, feel free to comment below. What else did we discuss? The other things are things that we've already been talking about. So yeah, I'm going to wrap it up here, guys. Thanks for the wait. Like I said, please like, share, subscribe. Feel free to comment below. I'm also going to do another quick video about another Netflix series that I saw, just to kind of catch up on the lack of videos. And also, like I said, if I end up watching anything that I feel like it can tie into mental health and kind of can give you this image of what we're talking about, I'm always going to discuss it. So see you next video, guys, which should be momentarily. And thanks for taking this journey of love, growth, and healing. And I'll see you next time.